Hello friends, today I am going to reveal some true facts of a common allopathic medicine, paracetamol. But first of all, I request you to please share and subscribe my channel for getting my informative true facts videos uninterrupted. Please note that subscription of my channel is free of cost. Now paracetamol. Paracetamol is a common allopathic medicine. It's also called acetaminophen. Prescription is not required for purchasing this medicine. Description: Paracetamol is to temporarily relieve fever and mild to moderate pain such as muscle ache, headache, toothache, arthritis and backache. Uses of paracetamol in fever, headache, muscle pain, menstrual crash, post-immunization pyrexia and arthritis. Its side effect: nausea or vomiting, fever, allergic skin reactions, gastric and mouth ulcers, anemia, fatigue, Stevens-Johnson syndrome. Contact your doctor if any of these symptoms are experienced on a regular basis. Highlights: onset of action. The effect of this medicine can be observed within 1 hour of oral administration. When given in the form of intravenous injection, the pain relieving action starts in 5 to 10 minutes. For fever reduction, the time taken is about 30 minutes. Duration of effect. The effect of this medicine lasts for an average duration of 4 to 6 hours. Safe with alcohol. Consumption of alcohol is not recommended during treatment with this medicine due to the increased risk of serious side effects such as severe gastrointestinal bleeding, dizziness, fatigue, weakness, rashes, nausea, joint pain, fever, jaundice, etc. Paracetamol is no habit forming tendencies were reported in paracetamol. It is used in pregnancy. This medicine is not recommended for use in pregnant women unless necessary and the potential benefits outweigh the risk involved. The medicine is not known to cause any harm to the fetus but should only be used after consultation with your doctor. Oral administration of the medicine should be preferred over the intravenous route. Usage with breastfeeding. This medicine is safe to use during breastfeeding. It is advised to consult your doctor before taking this medicine. Monitor the infant for any undesired side effects and report any incidents of rashes on the skin or diarrhea in the infant to the doctor immediately. Now, when not in use, in allergy, analgesic nephropathy, that's a kidney disease, and severe liver impairment, doses, misdose, oral and the rectum forms, signs paracetamol is administered as when required. The likelihood of missing a dose is very low. If you are on a scheduled dosing segment of this medicine, the missed dose should be taken as soon as possible. It is advisable to skip the missed dose if it is already time for the next scheduled dose. Do not double the dose to make up for the missed one. Do not double the dose to make up for the missed one. Since paracetamol injections is usually administered by a qualified healthcare professional in a clinical or hospital settings, the likelihood of missing the dose is very low. Overdose. Oval and rectum forms. Seek emergency medical attention to contact your doctor in case of an overdose with paracetamol. Injections sometimes the medicine is administered in the hospital or clinical setting by a qualified healthcare professional. The likelihood of overdose is very low. However, emergency medical treatment will be initiated by the doctor if an overdose is suspected. Interactions. All drugs interact differently for persons to person. You should check all the possible interactions with your doctor before starting any medicine. Interaction with alcohol. Drinking alcohol with this medicine can have a severe effect on the liver. Consumption of alcohol is not recommended during treatment with the medicine due to the increased risk of serious side effects such as severe gastrointestinal bleeding, dizziness, fatigue, weakness, rashes, nausea, joint pain, fever, jaundice, etc. disease interactions, alcoholism. This medicine should be used with extreme caution in patients with chronic alcohol use due to the increased risk of serious liver injuries. Close monitoring of liver function is recommended for such patients. Reports any unusual symptoms to the doctor immediately. Appropriate dose adjustment or replacement with a suitable alternative may be required based on the clinical conditions of the patient. Liver disease. This medicine should be used with extreme caution in patients with liver function impairment or active liver disease due to the increased risk of severe adverse effects. Close monitoring of liver function is necessary while receiving this medicine. Report any symptoms such as nausea, fever, rashes, dark urine etc. to the doctor on priority. Appropriate dose adjustment or replacement with a suitable alternative may be required based on the clinical condition. Food interactions. Information is not available for food interactions of this medicine. Lab interactions, 5-HIAA urine test. You may get a false positive result for this test while taking this medicine. It is advised that you inform the doctor and lab technicians about all your current medicines including herbs and supplement before undergoing any lab test. This is not an exhaustive list of possible drug interactions. You should consult your doctor about all the possible interactions of the drug you are taking. General instructions, oral forms. Take paracetamol as advised by your doctor. You may take this medicine with or without food. Do not take it in a larger amount than advised. Users should never exceed the recommended daily maximum dosage limit of 4 grams in a 24-hour time period. Rectal forms. Use a paracetamol exactly as advised by your doctor. Do not take in larger or smaller quantities than advised. Injections. Paracetamol should be administered by trained healthcare professionals as per the doctor's instructions. Consult the doctor if you experience any undesirable side effects. Ensure that the treatment course is completed. Do not stop the use of this medicine without consulting your doctor. Warning. Warning for a special population. Pregnancy. This medicine is not recommended for use in pregnant women unless necessary and the potential benefits outweigh the risk involved. This medicine is not known to cause any harm to the fetus but should only be used after consultation with your doctor. Oral administration of this medicine should be preferred over the intravenous route. Breastfeeding. This medicine is safe to use during breastfeeding. It is advised to consult your doctor before taking this medicine. Monitor the infant for any undesired side effect and report any incidents of rashes or skin or diarrhea in the infant to the doctors immediately. General warning, overdose. The medicine is available in the market in various dosage forms. Read the label carefully before consuming this medicine to avoid overdoses. Overdose may result in liver damage. Seek emergency medical attention if any overdose of this medicine is suspected. Liver disease. This medicine should be used with extreme caution in patients suffering from liver function impairment or active liver disease due to the increased risk of severe adverse effects. Close monitoring of liver function is necessary while receiving this medicine. Appropriate dose adjustment or replacement with a suitable alternative may be required in some cases based on the clinical condition. Now, chronic malnutrition. This medicine should be used with extreme caution in patients suffering from malnourishment due to the increased risk of severe adverse effects. Appropriate dose adjustment or replacement with suitable alternatives may be required in some cases based on the clinical condition. Other details of paracetamol can be taken with or without food as advised by your doctor. To be taken as instructed by doctor. Does not cause sleepiness. How it works? Paracetamol increases the pain threshold and decreases swelling. It also brings down elevated body temperature by acting on heat regulatory centers in the brain. Classification, category, miscellaneous analgesics, scheduled OTC. In my next video, I will reveal some true facts of other more interesting and useful topics. Thanks.